and thank you so much for coming. My name is Edita Osberg, and I'm the managing director and the founder of Nouzetwals. I moved to Mauritius 3 years ago with my family, with my husband and two children. My son is 7, my daughter is 5. And in the UK, I have an international healthcare recruitment agency. And that means that we specialize in recruiting all healthcare professions predominantly to the UK for the NHS, but we also have several contracts in Australia and New Zealand. So workforce development and pastoral care is part of daily life for us. Jean-François?
Hello everyone. So my name is Jean-François Mutusami. I am based in Mauritius and I currently work in the banking sector. I'm specialized in product and business development. I'm very pleased and honored to be with you tonight for this webinar. It might be tonight or today, I don't know the different time zones, and I'm very happy to share with you some exciting news about the Nouzetwals initiative.
Thank you. Next slide, Mark, please. So first of all, let's just tell you about Nouzetwals and how the concept came to be. For me, my early experiences of Mauritius really demonstrate that Mauritius is a community built on compassion. And from the day we arrived in the UK, we felt in Mauritius from the UK, we felt very, very welcomed and very supported by the community, both the local community and the expat community. So it feels like a very inclusive environment. And across our towns and villages and hospitals, schools and homes, those acts of care sustain the heartbeat of our nation. It's that nurse that comforts a patient through the night, and the teacher, like Jean-François' mom is a teacher, for instance, that nurtures a child's potential, and then the neighbor who really checks in on you or the other elder neighbor next door. And this all really is the spirit of humanity, and that's what unites us. And for me, this is what unites Mauritians and expatriates in this beautiful country. Everyone that chose to live here, to work here, and to care for this beautiful island that we call home. Nouzetwals exists to celebrate that spirit. So to remind each and every one of us that care is not just what we do, it's who we are. Next slide, please, Mark.
So I will tell you why I joined this initiative, Nouzetwals. And it all started with a discussion I had with Edita a few months ago. And she shared with me her thoughts about the healthcare system in Mauritius and how good the healthcare system was in Mauritius following a few personal experiences she had gone through. To be honest, I was quite surprised by her answer and what we talked about, because I hear so much about the healthcare system locally. In the private and public sector, I've heard so many complaints and I just couldn't figure out what she was talking about. But in fact, while thinking about it, she wasn't that wrong, because it reminds me of my dad, who is in the medical field too. He's still active. He's 85 years old, and he's a medical representative. So the medical representative in Mauritius, what's his job? He just meets doctors and pharmacists and around the island, and it gives him some purpose, because he's 85 years old and he wants to be useful to the society. And 5 years ago, when COVID struck, we were all confined in our homes, and I was just enjoying my time at home. And I was quite surprised. After 1 week, my father knocked at my door and told me that he was going out to help the pharmacist on their duty. He arranged nearly everything. He had his island-wide pass valid. He had already his masks and his gears, protective gears, and I was quite surprised. I just asked him, stay home, what are you doing? You are 80 years old. And why are you trying to help those people? And he said, you cannot understand. It's my duty to go out and help these people, help these pharmacists to just share their job and be part of their job. So then I realized that healthcare meant so much to him. And there are so many people like my dad who serve this country, serve Mauritius through care and assistance, and they expect nothing in return. Uh, I work in the financial sector and I expect something in return from my activities. And these people, they do their work and they expect nothing in return. And it could seem surprising why healthcare is something that is of interest to me, but it's far from the truth because no matter what is our job or field of expertise, healthcare concerns every one of us. So we need to celebrate the people who work in healthcare because it's a necessity and it's vital. We often take for granted that these volunteers, nurses, pharmacists, and doctors, they always are there for us. It's not really true. And through Nouzetwals initiative, we want to celebrate life. We celebrate love every day throughout our children, our parents. But Nouzetwals is here to celebrate life by honoring those who help us preserve it. That's for me why I'm part of this initiative. Next slide,
Thank
please.
you. Thank you so much, Jean-Francois. And I would like to add to that as well that we have a very good understanding of the great shortage of healthcare professionals around the world. And that shortage of health professionals everywhere, including Mauritius. So for instance, in the UK, we have 22,000 vacancies for nurses. In Mauritius, there's a shortage of about 1,500 nurses. That means that these healthcare professionals come to work every day and they are short-staffed. So they often do more than one person's work. And that is very challenging. The role of a nurse or a doctor or a care assistant is already very challenging as is on its own. And then to be able to support effectively and with compassion the system, it really requires a lot of commitment, a lot of dedication, and a lot of compassion. So we want to really shine a light on that. And so our vision is Mauritius, where every act of care is a source of national pride. And in the UK, we are extremely proud of our healthcare workforce. We are extremely proud of our NHS staff. We celebrate them, we appreciate them, and whenever possible, we try to make them feel special. And so if you're a nurse, but for example, in the UK, you walk into an estate agency, you are looking for a house, and you're automatically the top choice for any landlord to have you as a tenant because you are a person of professional standing. You are a pillar of community. And I would like to see this pride and this support from the nation also visible here in Mauritius. We're really celebrating those that dedicate their lives to others. We want them to feel seen. We want them to feel valued and appreciated and celebrated, and really recognize the fact that our health and social care systems are a symbol of unity, a symbol of compassion and excellence. So the mission here is to really, Nouzetwals really exists to unite and uplift everyone in the health and social care, whether it's a clinical or non-clinical role. Everyone who contributes to that system it needs to be recognized and appreciated. We really aim to introduce a culture of recognition in Mauritius because you do have the compassion, you do have that passion for the professions, and you do your best. So bringing that culture of recognition and restoring the national pride hopefully strengthen the morale and also build connections across the generations here in Mauritius. So we're looking to foster networks of mentorship, mutual support. We want the healthcare professionals to feel part of the community, and that we as the community stand by them, we support them, we are here to celebrate them because they care for us. And who cares for them? So we want this to be, we want health and social care to become environments where everyone learns from each other, where they grow together, support each other, and they motivate the next generation of carers to join the healthcare systems too. Thank you, Mark. Next slide.
So our goal is to recognize these contributors, unsung heroes, as I mentioned in a previous post. And we want to celebrate them in a ceremony, at a ceremony planned on the 25th of April next year, 2026. We will honor their achievements, and also we will try to bring together stakeholders as well as the community of experts for a day of sharing. It's a day of sharing, a day of discussions about opportunities and innovation in a sector that is constantly evolving. These doctors, nurses, they need to be updated regularly. So being at work every day, I can tell you that we don't have time to update ourselves. Being constantly under pressure with patients every day. So this day would be a special day for them to take stock of what is available, what can be done, and also there will be a ceremony for the awards. The venue has not been identified yet, and we are working on the best possible options. But this event, which is scheduled end of April next year, will, I hope, and we hope, mark the beginning of something new, of continuing celebrations around this health sector. So we believe that Mauritius has all the capacity, the capabilities to position itself as a regional hub. We have been discussing with authorities and they are confident that we can do it. For the healthcare sector, the healthcare excellence, we are set as example and we want to be considered as examples for not only our country, but the region also. So we invite you to save this date and be ready to be with us next year in April. Next slide, please.
Thank you.
Edita, it's up to you.
Thank you so much. The steering committee decided on 13 categories, which honor every stage of the journey of a healthcare professional. So we would like to start by recognizing exceptional students and rising stars. We then move to clinical and non-clinical excellence. We would like to recognize teams, educator and training initiative of the year also, innovation and research, quality and safety, staff well-being and leadership, fairness, equity, diversity and inclusion, community care and outreach, lifetime achievement and patient choice. And the categories you can see on the screen with an asterisk are categories that the public can also take part in and nominate their service providers or the healthcare providers. So through these awards, we are really building an inclusive platform. This will be available for both public and private organizations, NGOs, clinical, non-clinical roles, but also Mauritian and expatriate healthcare staff and any non-clinical staff working in health and social care sectors too, who have decided to come to this beautiful island, to this beautiful country and dedicate their lives to supporting our community. Thank you, Mark. Next slide, please.
So what makes Nouzetwals unique? It's about fairness and inclusion, which will be at the heart of this initiative. We want anybody to be free to participate in all sectors. Any role within the health sector counts. We are not choosing the sector. We're not choosing the kind of people who does the best for someone in the health sector. Anybody is free to participate, and anybody is free to nominate someone in a sector which he believes is important within the health sector. So the professional and partners in Mauritius and abroad will also be celebrated. Our judges will ensure fairness and credibility in their decisions. There are local judges and judges from abroad who will be present to build on the merits of the candidates, and they will be judged on the merit. You can nominate yourself if you want, or any of your peers. The nominations can be done by any member of the public too, and provided that they follow the different steps that are recommended on our forthcoming website, which will be released very, very soon. And it will be a very user-friendly interface, and I guess that it will be very easy for you to fill it and send your appreciation about one or many candidates, as many as possible. And by nominating a potential award winner, you will have the opportunity to display how caring, how courageous, and how human your nominee is. It's very important to put this in the picture. And this webinar that we are doing today is the start of a series of many more. And I will leave Edita the floor to give more details about it. Up to you. And next slide, please.
Thank you so much. So as Jean-Francois mentioned, to help everyone understand each category in depth, we're going to run a series of webinars. Each session will introduce the award category, feature insights from the judges, share examples of past excellence, but also offer you practical tips on writing a strong nomination. So whether you're a student or a healthcare leader or a member of the public, these sessions are a really good chance to, first of all, connect, learn, hopefully get inspired, but also ask us questions and understand these categories best. So we are here to set you up for success. We really want to help. We want you to have all the tools to ensure that your nomination is successful. On the 11th of November, so that's a week today, we will commence with the early careers and inspiration. We will discuss in detail the Student of the Year Award, Rising Star, and Educator/Training Initiative of the Year. You can see the names of our judges for these categories here on the screen as well. So please let your friends know to come and learn a little bit more about each of these categories. We're working with the Ministry of Tertiary Education as well on making sure that our outreach campaign really gets through to all of the students in health and social care, so that we have as many participators as possible. And if you're an educator, you can also nominate your student. If you're a student, you can nominate your educator or yourself, as Jean-Francois mentioned, colleagues, etc. So please share far and wide and let everyone know to take part in this initiative. Thank you. Next slide.
So let's talk about the recognitions. Nouzetwals is not only giving a trophy and that's it, and just putting it on your shelf. It means much more. So the happy winners will also have obtained opportunities for scholarships, mentorship, and leadership programs to support their growth. So that's very good news for them. And amongst others, we're extremely proud to announce partnerships with institutions like the Florence Nightingale Foundation, thanks to Edita and her network. And through their scholarship programs, nurses, midwives will have the updated skills needed to cater for these changing needs in health that evolves every day. And so Nouzetwals is not just an award ceremony. The winners will keep on learning, they will keep on teaching, they will keep on, we hope, inspire their peers. And now, Edita, I think it's time to disclose the name of some judges. Next slide,
Yes,
please.
please. Thank you, Jean-Francois. And of course, our judging panel brings together distinguished Mauritian and international leaders in health, social care, education, and policy. Those senior clinicians, academics, and healthcare experts volunteer their time to review every nomination with fairness, insight, and compassion. Their experience ensures that Nouzetwals stands for recognition that is heartfelt, credible, and built on integrity. And it is my pleasure to introduce some of our judges here to you tonight. So, judges, you can now enable your phones and your microphones and cameras. And I will go and introduce you in alphabetical order to make sure I don't miss anyone. So, Alison, you are first. Thank you.
Thank you, Edita. Yeah, I'm very honoured to be a judge in this category. And even though, I mean, I'm towards the end of my career, and Edita will tell me off saying this, but I'm 65 this year. But then given the description earlier from Jean-Francois, I'm going to be another 20 years. So my background in education has been in two main domains. One is in nursing, paediatric nursing and general nursing and health visiting. And then I had an opportunity to do an English degree in Oxford. I'm not sure how I got there, but the joy for me was combining my two degrees in teaching of international healthcare professionals around the UK for about 7 or 8 years, and then more recently with some teaching of OSCE. And I just love meeting people with ambition, people who have made a difference, and I meet them every day, really, and I want to see those people putting themselves forward, or being you nominating somebody else. Even if you think that you've made a very humble contribution, that is not necessarily the case, because you might have hundreds of patients, you might have hundreds of students or mentors or peers who admire you, and you know, we want to get these awards off the ground, so we would like to see as many nominations as possible. And I think that this platform is an amazing way to do that, and you know, you're guided every step of the way. So please be strong, be forthright, don't be too modest like me, and enjoy it as well. Enjoy it.
Wonderful. Thank you so much, Alison. Vicky?
Oh, hello.
Hi, I'm Vicky from Mauritius. Okay, I had from now I have like 12 years in the sector, in the public health sector, and I work also in private. Actually, now I'm coordinating nurse at International SOS. So when I got the opportunity to be a judge for this wonderful initiative, I immediately accepted, because it's one of a kind. I never seen something like that in Mauritius, where healthcare professionals have never been celebrated as we are planning to do it this time with this award. And my focus has always been to take care of my peers, to cater for their well-being. Also, I've always fought in all the ways possible to ensure that their mental health are being preserved. And recently, I've just completed my BSc, and one of the main modules I like and I like tend to appreciate was leadership. So, being selected to be a judge for the Staff Wellbeing and Leadership Award, I'm very grateful for that. Thank you, everyone. And I would like to say this is one of the biggest initiatives I've seen, like, for years and years in Mauritius. Nothing like that has actually happened in Mauritius. Yeah. Thank you.
Thank
you.
you. We
Yeah.
do not
Thank
do
you.
things small. We do things big.
Yeah, it's quite big. I've never seen something like that, as I said.
Thank you so much, Vicky. Dr. Dharmesh.
Hi, Edita and everyone. Can you hear me actually?
Yes, we can.
Yes.
Okay, thank you very much for, first of all, for inviting me to be in your steering committee. It was a surprise for me. So um, actually, I would like to congratulate you for this, all that energy you're bringing in and to help all the health sector and the development which will come, I think, in the coming years with this. So I think it's a long-term project and I'm very happy to be part of it. Actually, I'm a consultant cardiac surgeon in Strasbourg University Hospital in France, for those who don't know me. I do adult cardiac surgery, pediatric cardiac surgery, and all this stuff. So I'm not going to those technical details, but just giving you an update of how things go on for me. I try to bring my expertise regularly on the island and try to increase, get the level up in terms of medical and surgical care with organizations of, I do free screenings for the people across the island, and I think I have got, a big overview of what's going on and how we need to improve the whole system. So I think Nouzetwals is a very nice way to celebrate the small individual efforts that finally get into the big collective things. And for me to participate with you guys would be an honor. And I will try to give you my best and my vision as a whole. So I think fitting me in your team excellence is a good way to be a judge in this whole in this whole setup. So I'm very glad, and anybody who wants to exchange with me, please feel free. I'm always available. I'm sorry for some delay sometimes, Edita, in my answers, but you know how OT life is.
Yes,
And
of course.
actually, I think in Mauritius we badly need to elevate to bring this level up, and to do that, you can't just rely on the experts coming in. We should also make the people feel that they are worthy, they deserve, that recognition when they do even the smallest stuff. So for me, it's a nice way to participate and bring my share with you guys. So thank you very much, and I hope my participation can bring some hope to the people.
Thank you so much. That's wonderful. Hetao?
Hi,
Hetao.
everyone.
Oh, yes.
Can you hear me now?
Yes.
We can.
Okay. Good evening or good afternoon, wherever you are in whichever part of the world. It is very lovely to see all of you and meet all of you. Edita and I go slightly back when we were working together on recruitment for nurses within, to the UK. But I must say I'm really, really proud of you, Edita, and of this initiative, but also to be involved in such a compassionate and such a lovely initiative, recognizing the people who actually care for others. And as you know, I've in any way, shape, or form, I love to be involved where there's anything to do which makes a difference. So thank you very much for having me on the panel.
Thank you so much, Hetao. It's a pleasure, and I'm so delighted that you're part of our program too. Joe LaPlana.
Hello. I didn't know I was going to talk, but it doesn't matter. I'm Joe, and I'm originally from Spain, but I came to the United Kingdom quite a long time ago. And I must be my Spanish spirit, but in Spain, we celebrate everything. And when I came to England, I noticed that they're not very good at partying for anything. And this is the worst. It's just, if you know anybody who's done anything, who have an impact on you or on your mom or your any colleague or anything, doesn't matter how small. Just put it on a piece of paper, send it to us, and let's celebrate that because small things sometimes can make a huge difference. Even if you think, oh, it's not big enough, it's not going to win anything, doesn't matter. Put it on a paper, send it to us, and we will have a look. And you never know.
Yes.
We may see you next year on the 27th of April on the award ceremonies. Just dream big. I always say, just celebrate it. And doesn't matter how big or small, just any occasion for me to open a bottle of cava or champagne that is good. And when Evita called me and said, would you like to be part of these fantastic awards and help to promote health care in Mauritius, I say, yeah, definitely. Let's celebrate. Anything celebrated, I mean, doesn't matter how big or small.
Thank you so much, Joe. And I have to share with everyone that Joe, I think, has the most awards for recognition, workforce well-being, fairness and equality, neurodiversity. We couldn't even count these awards. He is such an accomplished, inspiring, amazing nurse. And we absolutely love you, Joe. So thank you. It's a huge honor to have you here with us too. Mercy is joining us from Kenya.
Evening, good afternoon. My name is Mercy. I'm from Kenya, and I recently graduated from the Florence Nightingale Foundation as a global scholar. And thank you to Prof. Greta, who is part of the team, for the amazing opportunity that she granted to me. It's been a game changer for me, and it's out of this opportunity that I'm here with you, all the way from Kenya. By profession, I'm a nurse midwife. I just completed my master's in advanced practice in midwifery. And I practice both in the clinical area and also in academia. I'm a clinical instructor with the Aga Khan University, Nairobi. And I also do midwifery clinical work at the Nairobi Hospital. I'm very excited to be part of this team, and I look forward to what the future holds for me. And I'm really humbled to be part of such a noble task of recognizing the healthcare professionals and the unsung heroes. So thank you so much for this great opportunity. Thank you.
Thank you so much, Mercy. Thank you. Wonderful. Nikki.
Hi, my name's Nikki Ashby, and I am a nurse by trade, and I worked in critical care and major trauma. My career has spanned over 40 years, and I've worked in many different areas with many different global leaders, and really thank Adita for getting me involved in this project and having a conversation with me. I have set up a company called Axis Culture Group, which is around leadership and is around pastoral care and also executive coaching to develop leaders and to develop teams really in healthcare to be able to deliver the best they possibly can for the patients that are within their care. What I've really enjoyed about this process so far is that I'm actually in the patient choice award judging category, and that's really important to me because I've won some awards for patient choice, and it means such a lot to those individuals that are brought forward. Who else is better to actually bring forward a nomination than patients or relatives or other team members that can actually bring somebody forward and say this is a difference that has been made to the patients. And that is what we really want to do, is to make a celebration here of the care that you all deliver and also the systems that you deliver it in. So please, as Joe said, add in any piece of paper, talk to us, we can help you. We'd like to hear, particularly around the Patient's Choice Award, those areas that have been really influential, because those are the people that are receiving care. And wouldn't it be fantastic for us to be able to have lots of nominations to demonstrate just how great you all are? Thank you.
Beautifully said, Nikki. Thank you so much. Lucy is up next.
Hello everyone, I'm Lucy and I've worked 20 years for the NHS, both secondary and primary care in non-clinical roles, so managerial and administration, and I'm deeply honoured and excited to be involved in this Nouzetwals Awards. I think it's absolutely fantastic that we're celebrating both clinical and non-clinical staff. It's excellent.
Thank you so much, Lucy. Sanjana.
Hi, good evening, everyone. So I'm Sanjana Gobinambujan. I'm a clinical psychologist from Mauritius. I've been working here for 10, 12 years, and I've had experience with the public sector. I've worked a lot in government hospitals, and I've worked with some amazing people. And honestly, I'm honored to be here, more so because I've seen firsthand the hard work that Edita was mentioning earlier, where people are doing the job of 3 or 4 people, not just 2 sometimes, and they still do it with the same compassion, and they still have the same motivation to just give their best. And I think it's just fair that, you know, the time has come for us to recognize and just put all that hard work on a pedestal and really celebrate it. So I'm so grateful to be able to also bring that local and contextual aspect to this. As everyone else said, we're open to have a chat and to kind of guide you through anything that you might want to chat about. We're more than happy. And once again, thank you, Edita, for having me on board. And yeah, looking forward to this. Thank you.
Thank you so much. And next up is Sisekelo.
Hello, everyone. Hope you can hear me.
Yes, we've got
Yes, we can.
Yeah, my name is Nouzetwals. I'm from the Kingdom of Eswatini, a very small country, and we boast ourselves with unity and culture. I mean, that is a very important element when it comes to the health sector, because it embodies the spirit of inclusivity. Well, currently I'm working with NELFT, which is the Northeast London Foundation Trust. I'm serving as a clinical lead here. And over the years, I've worked in community and both inpatient with a diverse group of individuals, but I had a particular interest in young people, youth development and empowerment. And now I'm very excited to be part of this initiative. I mean, to recognize individuals who are making a real difference. I'm really, really honored. Thank you.
Thank you, Sisekelo. It's wonderful to have you here. And just to share with everyone else as well, we, our recruitment agency in the UK, recruited Sisekelo to work with Debbie, who's coming on just next. But he is a true superstar and one and only ever nurse to have been offered a band 7 position straight from the outset. So those who know the UK system will know how incredibly special that is and how special Sisekelo is as well. And last but not least, my very, very good, wonderful friend, Debbie.
Hi. It's really good to see you all tonight, and Sisekelo, you absolutely topped it when we came to do the interview. So I know our chief nurse is so excited. He ran out to tell us that he'd offered you the band 7, so I won't forget that. And so I also work in North East London Foundation Trust. I'm a director of nursing here for patient experience. I've been a nurse for nearly 40 years now, so I'm very proud of being a nurse, and I think these awards are absolutely fantastic, and I was really honoured and chuffed to be asked to be one of the judges. So I'm so excited and looking forward to all of your applications, and we really, really encourage you. I mean, one of my passions is really around patient experience, but to be honest, staff experience is equally important, because I think if your staff feel happy and looked after and their well-being is cared for, then you'll always get really excellent patient care. So I think these awards, if they help people feel valued and celebrated, then obviously that will impact on the care that they're able to give. And also we would, want to look after you. So my category is wellbeing and leadership, and I'm very proud to be part of that. So really, really looking forward to all the applications. I'm very excited.
Thank you so much, Debbie. And that's all of our judges introduced. So Mark, can we move to the next slide?
So I must say I'm very impressed by all these people who are attending, who have volunteered to be judges. I'm very thankful on behalf of the Mauritian community. Thanks for being present for our community. Thank you very much. So how to nominate is very easy, very simple. The first step is to create a free account on our forthcoming website, which is scheduled on 11th of November next week, if everything goes in the right direction. And I guess it's all nearly done now. Sorry. So it's nouzetwals.org. You log in and you can submit your application. You choose the most appropriate category, and or you let our team guide you. There will be a team to guide you and help you, customer service. You answer the different questions that will be asked. What your preferred candidate did, why it mattered, and what impact it brought to the community. And the submissions should reach us by Friday, 9th of January 2026. By the time you submit, you can contact us to get guidance on how to fill the forms. We are available to help you, and the better you craft your submission, the better it will be, and you put your candidate in the best position to get the award. So we are looking forward to get your applications and submissions. Next slide, please.
Thank you. And now we move on to timeline and evaluation. So as Jean-Francois mentioned just now, the nominations will open on the 11th of November. You can go on our website and have a look around a little bit more to find out about the categories, read a little bit more about them, but potentially more about who we are and what we do. The deadline for submissions is the 9th of January. And what's going to happen between the 11th of November and the 9th of January is once you submit your nomination, you can still go back to the account, amend it, update it, add additional evidence that might have potentially surfaced during the course of that window of opportunity. But the first stage of the process, that is not part of the evaluation, is that your nominations are going to be checked by our support team. And if our support team believes that there is an opportunity to strengthen your nomination, whether by adding potentially additional evidence or expanding a little bit more about a particular aspect of the nomination, they will contact you via phone or arrange a video call in English, French, or Creole, whatever is your preferred language, and have a discussion with you and give you a little bit more information, tips, and guidance on how to strengthen your nomination. So we're really, really determined to make sure that you are set up for success, that we give you all the tools and we can support you in being successful. From January until March, the nominations will then be passed on to our judges, and every category will have at least 3 international judges and 1 local judge assigned to it. And the nominations will then go through the online evaluation. So the judges will evaluate the content that you provided, and whether you nominate yourself or a colleague or a team or employer. That first batch is going to be then reduced to potentially 15 or 20 nominations that will be shortlisted for an online interview. The online interview will take about 15 to 20 minutes and will be in the presence of all the judges, where further questions will be asked of the nominee or the nominated team. And once that second stage is completed, we will shortlist potentially 6 or 7 finalists and invite them to the ceremony on the 25th of April. All of the finalists are welcome to come to the award ceremony for free. We really want to make sure that that opportunity is available to everyone with no restrictions. So nominations are also free to submit. There's no fees, no cost attached at any point. And we really look forward to seeing you at the gala on the 25th of April. The judges, international judges and the steering committee members will be flying in as well to see us. So we very much look forward to welcoming them in Mauritius. The only 2 exceptions to the 2-stage evaluation are Lifetime Achievement and Patient Choice Awards. They will undergo a single stage, only the online evaluation stage. So you really do need to make sure that the evidence you provide is very, very strong. But again, feel free to reach out to us at any point if you would like to discuss any part of the application. Thank you so much. Next slide, please.
So we'll talk about building a lasting legacy, and it's all about sustainability. So in banking, I'm in the banking sector. I talk a lot about sustainability, and that's how I met Edita. We're working in cohorts of entrepreneurs who need to sustain their business and survive. And sustainability is very important in all sectors of the economy. For example, in banking, a bank cannot survive if there's poverty everywhere, because no one would take loans, for example. So we are all called upon to look at sustainability, and the Nouzetwals program is also about sustainability, about creating awareness and inspiring young professionals to follow the path of their elders. And it's very important to look at this in this perspective, because we have a system where elders are always on the top, even in the banking or in any sector, and those who have new knowledge, they take time to grow. And it might look strange, but it's the harsh reality, even in Mauritius. So we need to continue and build this roadmap for our sectors, and the healthcare sector is a very important sector to us. We need to help these youngsters who have knowledge and who want to build further their knowledge to grow on this roadmap towards excellence. And we need to create this culture of recognition towards the 4 elements that have been mentioned already, like leadership and culture, for example, how we promote compassionate and leadership, values-based leadership through leadership and culture. Pastoral care and well-being is important, supporting the mental and emotional resilience of our healthcare sectors and our patients. Integrate the workforce together to bring results through the international partnerships and professionals who connect with us. We have a solid proof of your interest in this Nouzetwals Awards by being present here. So our aim is to bring together all the medical and allied forces and build these connections, meaningful connections. It's not only one event, it's a roadmap that we want to build for our workforce here, our healthcare workforce. So when I talk about sustainability and I hear my colleagues in banking sector and everywhere talking about it, they understand that it's urgent. It's urgent that a country cannot survive and foresee its growth without a proper medical system. Mauritius is small, UK is big, but at any scale, we need to have a proper medical system. I take the example of Rodrigues, for example, where they are quite struggling, but it's being done. But patients sometimes need to move to Mauritius, so it takes time. So we need to foster this culture of survival and foresee growth through this medical system in Mauritius and elsewhere. It's the same for education and other jobs in Mauritius, but our proper healthcare through dedicated and proud workforce would ensure this continuity and for our economies, for our businesses. So we want to start this culture together with you, with the people who will listen to our webinar tonight, and through all those who will share the news that Nouzetwals is on. We are on to serve this nation through healthcare, through other sectors within the healthcare sector, and we want to promote it properly. So we want also to cross the borders and show this appreciation in schools. And I think Edita will give more details about it in the next slide.
Thank you. One of the very important things for me is for the community to really understand the depth of responsibility, the weight of responsibility, and the commitment and the dedication of health and social care workers. Being a nurse is more than just putting a plaster on a knee and giving an injection. And there's one story that I often recall, and it was during one of our recruitment events for Oxford University Hospitals. We were recruiting palliative care nurses, and this wonderful young nurse walks into the interview and she says, "You only get to give your patient the death that they want once. You only have one opportunity to get it right for them. And so if your patient's wishes are to pass away in the hospice, you've arranged everything to make it happen, and then in their last hours they change their mind and they would like to be at their home with their family. You move heaven and earth to make it happen, but what happens when you don't get there on time?" And that story gives me goosebumps every single time I tell it, because every day these nurses get up and then they do the same thing for the next patient and the next patient. And what about the neonatal nurses that care for the 26-week-old premature babies and nurse them to health and stay up all night making sure that the babies are well? And one of the reasons why we really want to be able to reach into the community is to also inspire the next generation. So this next initiative was actually very proudly suggested and introduced by our amazing judge, Joe LaPlana, who you just met. And the idea is to run a national level competition in all schools and ask the children to design a mascot for Nouzetwals. And this is how we're going to introduce the concept to the children and educate them on what Nouzetwals is. And the mascot will need to embody the pride and the celebration of our health and social care staff. So through that, we will be able to really get the children curious about healthcare professions and why we should really celebrate these incredible people that care for our nation and for our community. Once the mascot is created, we would like to then be able to go to schools with our judges and steering committee members when they arrive here in April, and have discussions with the children about the visible healthcare professions, like nurses, doctors, and the invisible healthcare professions, for example, nutritionists and pharmacists and occupational therapists. Give them an insight into what these professions do, what these professions encompass, and then be able to say to a child, "Is your daddy a nurse?" "Yes." "Oh, wonderful, your daddy is a star. Here's a toy for you." And for those children to go home and feel extremely proud of their parents and start getting more and more curious about what it is that daddy does, that everyone is so proud of him. Why is everyone so proud of him? And hopefully inspire the next generation to join the healthcare workforce, because healthcare workforce is a family. And nursing degree, for me, from my personal experience, a nursing degree is actually worth more than your passport, or a healthcare degree is worth more than your passport, because at some point in time, before we discovered this beautiful island and we moved to Mauritius, my family and I dreamed about living in Australia. And with my British passport, we weren't able to get a visa for Australia because the skills that we have are not what they need. Whereas, regardless of which country you come from, if you have a clinical degree or a nursing degree, you will be welcomed in every country around the world. And with my recruitment hat on, what I'm seeing is that this global shortage of healthcare workforce is increasing every year. We have aging population, and with that come long-term illnesses. So although people live longer, and that's wonderful, we celebrate that, they live with conditions that often require care 24/7. And so there is a need for more and more workforce. There are new emerging professions that appear every few years. So 30, 40 years ago, we didn't have influencers, we didn't have wedding organizers. And so we lose a proportion of our youth to those professions every year too. And the World Health Organization estimates that by 2030, so that's only 5 years' time, there's going to be a global shortage of over 1 million health professionals around the world. So until we start growing more of our own, we will just keep recycling the workforce and recruiting them from one country to another. And so it's really, really important that we support the nation, we inspire children and inspire youth to join the healthcare workforce and care for our nation in the years to come. The other side also to this program that is very important for us is to create an environment where our children that hopefully study medicine or nursing or any other healthcare related professions come into an environment where they are championed, they are mentored, they are supported, and they can be the best versions of themselves, where that recognition is part of fabric, part of life, both within the healthcare system, but also on a national level. And that is another reason to become a healthcare professional, that national pride that you are doing something good for the community, for the good of the country. And you are appreciated, you are seen, you are valued, and you are treasured. And so with that in mind, I'm just very conscious of time. I would like to give the floor to all of you. I think that was our last slide, Mark. Oh, join the movement.
There's a last one. There's a last one.
One more.
Well, one more rapidly. So our call and ask towards you listening to us is to join this movement. Simply join us, be part of Nouzetwals, because Nouzetwals belongs to everyone, as it's mentioned. And our jury panel is looking forward to read the nominations as a citizen or professional. And we would love to have you also eventually as brand ambassador or volunteer to help us bring this initiative as high as possible. Talk among your friends, your relatives, your networks. And you can, of course, partner with us as sponsors or supporters of Nouzetwals. You can reach out to us, myself or Edita, for more details. And most of all, talk about Nouzetwals in your respective networks, communities and workplaces. It's very important. The more Nouzetwals is known, and the more the reach will be. So any feedback and contribution from you are most welcome. There's a very strong structure and governance about this initiative. Me being in the banking sector, I can confirm it, but it's very, the structure is very strong, and we are keen to give more details if you require more details. So my call is for you is to let's build something big together. It's very important and it's very exciting. So let's set this example to making care visible, valued, celebrated, not just today, but for our future generations. I know that we are working not for today, but for tomorrow. And before leaving the floor to Edita for the closing note, I would like to quote a song that is very important to me. It's called We Are the World. We all know we are the world. but it resonates particularly tonight. The first four lines, it's there comes a time when we heed a certain call, when the world must come together as one. It's time to lend a hand to life, the greatest gift of all. I think it's time to celebrate life. Let's celebrate life together. And I thank you for your attention.
That's wonderful. Thank you so much. We welcome any questions you may have. Please feel free to put them in our chat. And while we wait for any questions, is there anything that any of our lovely judges or team members would like to add?
Can you hear me, Edita?
Yes.
So I'm activating my camera. I heard you talking about all this laudable work and initiatives that you want to bring and give some recognition to the people. But from my perspective, being inside this system for now like 2-3 years and coming with very high level stuff, there's one big challenge that I think we should all consider in a country like Mauritius, because I think we should think about it. We can bring the best out of the people and all that, but there's a big problem in the healthcare in systems like in Mauritius, ethics.
Mm-hmm.
So you can see that from a very tender age, the youngsters getting in have a tendency to deviate to what they should not be doing actually. Have you thought about anything like this, to bring this culture back, a good ethics? Because I think our country badly needs it actually. And this could be the basis to, re-give the dynamics and make people feel reassured and all that. So is this another, I know it's another subject completely, but have you thought about this?
And I think that really falls into the legacy programs, because the first legacy program that we will be delivering across public healthcare organizations and the private ones are welcome to join as well. And let me just emphasize that these legacy programs will be delivered for free. Any staff from the healthcare or health or social care sector will be able to participate. And the aim is there to deliver the first round of training and then identify champions within organizations within the regions as well. So the first step to addressing that concern will be that first legacy program, which focuses on organizational culture and leadership. And to introduce this culture of recognition, we need to start with the leaders. We need to have the buy-in from the leaders and work with those who already recognize this as an important part of life, of working life, but also convert the ones that are not currently subscribing to the recognition part of the workforce, because through recognition we will increase morale, we will increase engagement. Happy, engaged staff deliver better patient outcomes. So Rome wasn't built in one day, and we're not hoping to change the world by this time next year. But this is a start of hopefully a national movement that will commence with recognition and appreciation and really inspire people to do their best.
And one second question, how does it work if you want to take this to an international level, like for the ambassadors and all that?
Diplomatic circles,
Mm-hmm.
yes. Jean-Francois and I had several meetings already with various diplomats. Yesterday we met the wonderful High Commissioner of Australia. We're also working with the High Commission of India. We have met several of the ambassadors and high commissioners. Everyone is very supportive of the initiative. Everyone recognizes the importance and the value of this initiative, and we are currently discussing on how they can support us in making sure that this is the best that it can be.
And would you like to connect with like excellence institutions like university hospitals?
Yeah, of course. That's one of the big asks that we always mention when we meet with embassies, but also when we onboard new judges and steering committee members, is to grow our network of academic partners so that we can offer more scholarship opportunities to our winners.
Yeah. Okay. Good. Thank you.
Thank you. Thanks. Wonderful. I think our presentation must have been pretty good. Oh, Alex, hello. I have very much enjoyed this evening's webinar. Thank you both and all of the judges. So my question is, as the nominations are submitted, will the profiles be made visible for the public to be able to learn about these individuals? It would be great to connect content. It would be great content around these individuals, perhaps a day in a life series or podcast interviews, particularly as applicants submitted, so we can learn more about these individuals. Alex, this is fantastic. Thank you so much. What we are planning on doing is actually running spotlight campaigns from January till April. So throughout the judges' evaluation process and beyond the shortlisted finalists for the awards. Now, I would like to emphasize that we will randomly select people, teams, and organizations for these spotlights. So even if there is a spotlight that is that features a particular person or organization, it doesn't automatically mean that that person or organization is going to be shortlisted or is a winner. But we would like to shine as much spotlight on the amazing work that these people do. We are also planning on having a wall of appreciation, actually. So if you don't feel that perhaps there is enough merit to submit a nomination, and I would like to encourage you to do so anyway, but if you just would like to say a short thank you to any of your health providers or social care providers, you will be able to do that either in the form of a written feedback or a video testimony. And the more joy we can spread, the more appreciation we can show, the better. So it's a fantastic idea, Alex. Thank you so much. And the marketing team have a lovely plan for getting those going from January. Thank you. If there's no further questions, I would like to close by thanking all of you for participating. Thank you to our guests, but also a very, very special thank you to our steering committee members and our judges. It feels absolutely incredible to be in the presence of these incredibly accomplished clinicians and academics and senior leaders. I feel very confident that with all of your support, we will be moving at the speed of light as we have been, because this project has only kind of came to be about 3 or 4 months ago. So it is really all your support and all your advice and your guidance that ensures that we can move at such fast pace. I really appreciate you. I appreciate your time, and thank you. Thank you, everyone. I will be seeing you guys next week for the Rising Star of the Year, Student of the Year, and Educator/Training Initiative of the Year webinar. So wonderful to be with you. Please share far and wide information about Nouzetwals and our webinars, and give us a like on social media too.
Thank you, Edita. Thanks, everybody.
Thanks. Bye.
Bye-bye.